Proceedings for the morning, I'd like to request the guest of honor, Mr. Amitabh Bachchan, and the dignitaries to come and light the lamp, please. Ladies and gentlemen, come on, you can keep clapping. Thank you very much. Like to request at the outset, I'd like to request Dr. Shobha to felicitate the guest of honor, Mr. Amitabh Bachchan. Thank you very much, gentlemen. Request Mr. Puri to also come on stage and get seated. We'll just be, oh, he's already here. That's why we need the chair. Okay. Okay, very warm welcome to all of you. India has taken great strides in the field of medicine. But we always talk about India's achievements. There are some areas we probably not have made the right amount of mark. And that is to actually come at a point where our child mortality rate is probably the best in the world in terms of preventing it. Now, a nation is built on the fact that you take care of the health of their children. And that's why our endeavor, on Dr. Awasthi's part, is to ensure that Hospital are doing this in a small way by inaugurating Mumbai's first pediatric super specialty hospital. Now, one of the main purposes of this hospital is to actually provide complete pediatric services under one roof. 120 beds, 65 NICU beds, 15 PICU beds, which are state-of-the-art and the best in the country. The services are known the most important part of a hospital's domain. Services of PICU, NICU, general pediatrics, world-class pediatric surgery complex, advanced diagnostics, fetal medicine, genetic services, and many other pediatric subspecialties like nephrology, neurology, and endocrinology. A typical hospital launch can be done in a very standard way, but we've tried to do something in a very unique manner. A hospital is actually known for the patients that it caters to. And we are actually going to dedicate this particular day to a bunch of heroes. Heroes who have actually come out of Surya Hospital, who were actually going through a very tough phase. They were babies who were thin, who were sick, in terms of just born at 24 weeks and weight as low as 500 grams. And they came out in huge spirit and conquered this. So ladies and gentlemen, first give a huge round of applause for all those heroes that we are celebrating today. The endeavor of the hospital is to create more such heroes, and that's why these two things get together. What is important is also to notice that education is the primary need in healthcare services, whether it's for pediatric or it is for other hospital services. And therefore, one of the third plugs in the launch of Surya Hospital is the fact of that we created a Surya Child Care Foundation. Essentially, what the Child Care Foundation does is to cater to the needs of high-risk NICU graduates. It will have a parent support group, which is very important because the parent training process is very key. To tell you a little more about this, I'm going to request somebody whose passion has actually driven this project. He's been 27 years in the neonatal services. He's pioneered a lot of things in this work, and he knew exactly that it was a need for Mumbai and Maharashtra to get a one-stop place for all pediatric care. Ladies and gentlemen, the man behind the entire expedition, Dr. Awasthi.
Thank you very much. Respected Shri Amitabh Bachchan ji and distinguished guest, we are indeed privileged and honored by your presence. We know that you are extremely busy, but in spite of that, you have taken out time and come and graced our occasion. Thank you very much, sir. I'm sure this will go a long way in encouraging us and a lot of other professionals to improve childcare services in India, everywhere in the country, and most of the other states. It is surprising that there are hardly any dedicated pediatric hospitals in Mumbai. Mumbai is a financial capital. Not only Mumbai, entire Maharashtra, Gujarat, Goa, neighboring states do not have pediatric subspecialty hospitals. So our infant mortality, neonatal mortality, under 5 mortality, which are actually index of healthcare of our country, are extremely high. They are about 10 to 20 times higher than any developed country. And the reason behind is that there are less number of doctors, one, and most important is there are very few beds available. Even in a city like Mumbai, the number of beds required for neonatal intensive care or pediatric intensive care would be 1/3 or 1/4 of what they are required. So we've just begin this process. We want to continue further and help as many babies as possible in our country. We'll be able to offer complete, comprehensive pediatric package for all the babies and children under one roof, whether it means pediatric endocrinology, nephrology, various subspecialties. We have been working and striving hard for last 27 years in the field of pediatrics, and we are very proud that we have one of the largest and one of the very good equipped neonatal intensive care unit, which is a tertiary level 3. Here we are planning to start and we are launching a pediatric intensive care unit, which will again be one of the largest. It's going to be 15 plus 4, about 19 bedded pediatric intensive care unit, a tertiary level unit, and also advanced diagnostics, advanced surgical and laparoscopic facilities, fetal medicine and genetics, which will really go a long way in improving healthcare of children in Mumbai. We are also not stopping here. We are striving hard to develop some more centers like this. And also today we are launching our Surya Child Foundation for all these NICU graduates. They are known as NICU graduates because they were very small. They were 500 grammers, 600 grammers, all those babies who are born premature, they are known as. And if they go through NICU, they pass out from NICU, they have intact survival, neurologically normal or abnormal. We call them NICU graduates because it is the most difficult and harrowing time. These are small babies. They have fought. They have come out victorious. They come out intact. For them, we are floating a Surya Child Foundation. We'll have parents association for these babies. So these parents can meet together. We'll be counseling them. We'll be looking after their immunization, and we will be